Welcome to a presentation on avastin for eye treatment brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Analogy is a great way to explain complex medical conditions. Avastin is a medication used to treat eye conditions such as wet age-related macular degeneration, AMD. To help you understand how it works, let's use an analogy. Think of your eyes like a garden. AMD is like weeds that have taken over the garden and are blocking the sunlight from reaching the flowers. Avastin is like a weed killer that helps to get rid of the weeds and allow the sunlight to reach the flowers again. In this analogy, the flowers represent healthy vision and the weeds represent AMD. By getting rid of the weeds, avastin helps restore healthy vision in people with AMD. If you have been diagnosed with a condition that requires treatment with avastin, it is important to be aware of the symptoms associated with this condition. Common symptoms include blurred vision, difficulty seeing at night, floaters or flashes of light in your vision, and eye pain or discomfort. You may also experience redness in the eyes, sensitivity to light, and a feeling of pressure behind the eyes. In some cases, you may also experience a decrease in peripheral vision or a loss of central vision. If you experience any of these symptoms, it is important to contact your doctor right away for further evaluation and treatment. Avastin is a medication used to treat a variety of eye conditions, including wet age-related macular degeneration, AMD, diabetic macular edema, DME, and retinal vein occlusion, RVO. It is most commonly used in adults over the age of 50, although it can be used in younger patients as well. Avastin is also sometimes used to treat other eye conditions, such as macular edema due to retinal vein occlusion, diabetic retinopathy, and uveitis. Avastin is not recommended for use in children or pregnant women. Avastin is a medication used to treat a condition called wet age-related macular degeneration, AMD. AMD is a common eye condition that affects people over the age of 50. It is caused by the growth of abnormal blood vessels in the back of the eye, which can lead to vision loss. The cause of AMD is not fully understood, but it is believed to be related to aging and genetics. Other risk factors include smoking, obesity, and high blood pressure. Avastin is a medication used to treat eye conditions such as wet age-related macular degeneration, AMD, and diabetic macular edema, DME. It works by blocking the growth of new blood vessels in the eye, which can lead to vision loss. Treatment with avastin usually involves injections into the eye, which are typically given every 4-6 weeks. The number of injections needed will depend on the severity of your condition and how well you respond to treatment. After each injection, your doctor will monitor your condition and adjust the dosage or frequency of injections as needed. In some cases, avastin may be combined with other treatments such as laser therapy or photodynamic therapy. It is important to follow your doctor's instructions carefully and attend all follow-up appointments so that your treatment can be monitored and adjusted if necessary. The prognosis for avastin treatment for eye conditions is generally positive. Most patients experience improved vision and a decrease in symptoms. In some cases, the treatment may even lead to a complete resolution of the condition. However, it is important to note that avastin is not a cure-all and may not be effective in all cases. Additionally, there are potential side effects associated with avastin that should be discussed with your doctor before beginning treatment. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.